Hi, my name is Samantha Light. This is my clinical reflection video for Nursing 335. Throughout this video, I plan on explaining how I met every clinical objective throughout my semester within my clinical experiences. So, clinical objective number 1 is utilize previous knowledge of the sciences, liberal arts, information technologies, and nursing to develop skills as a nurse leader. I personally felt like I met this requirement through my peer and community leadership hours. Within my peer leadership, I was able to be the leader in an online case study for Nursing 309 students. That a patient had a small bowel obstruction, then led to peritonitis with signs and symptoms of anorexia and dehydration. And we were able to formulate different nursing diagnoses and interventions, and I was able to apply different previous knowledge learned throughout my semesters and clinical experiences to help formulate how priorities can change throughout the day and help them improve their knowledge and understanding of different processes. I also felt like I met this throughout my community blood pressures at Rodale. I honestly found this an amazing experience. It not only improved my confidence in therapeutic communication, but my manual blood pressures as well. Since in the hospitals we're always using the electronic blood pressures, that it really helped me feel better about my manual blood pressures. But it also helped me as a nurse leader being able to explain hypertension, hypotension, and how diets can really affect blood pressures to the visitors that wanted their blood pressures done. For clinical objective number 2 was apply basic principles of management to meet the challenge of an ever-changing healthcare environment. I personally felt like I met this throughout the advanced practice with Brian Weinberg at the Bariatric Center. He was a really great mentor, and I practiced fellowship as he was practicing transformational leadership with motivating others to the best of their abilities, and using his physician to help him when he was very unsure of a type of surgery that they implemented within the field, the practice that they were in. And I was able to witness a lot of post-op surgery patients and how different different lifestyle changes and the protein that they needed and water and exercise didn't only help them with their self-esteem and relationships, occupations, but this helped the bariatrics unit, and how they went from such a small unit that they're now having to expand with how big and ever-changing the healthcare system is. I also felt like I met that through multiple different videos I watched, how emergency situations and the preparedness that we need to ensure that the staff, the hospitals, and the equipment we have are adequate enough for any situation that comes to play, especially with social media being such a thing, such a big impact right now, crowdsourcing and making sure the real information versus fake news and the reliable sources we need to ensure that we're prepared and we are giving adequate information to the people and not believing whatever media is telling them at all times. For clinical objective number 3 is demonstrate leadership skills through effective use of communication by representing self, the college, and nursing in a professional manner. I personally felt like I met this throughout my professional emails that I would send to all of the clinical experiences prior to the day that we would set up. I would always make sure that I was very professional in my emails, explaining who I am. I am representing Cedar Crest College, that how long I would be with them throughout the day, what the goal is, and how they would be participating in my clinical experience. And then not only would I send them professional emails, but I would also give them a thank you letter throughout at the end of the day to explain something that I really learned throughout them and how much this experience meant to me. And I would always personalize it. And I found it really great that Brian Weinberg, for the advanced practice, I gave him my thank you letter at the end of the day, and he was so grateful. And I was able to explain something personal that he taught me, and he was just super excited about it, and he actually hung it up before I even left. And so I know that not only was this a learning experience for me, but I was able to mean something to him too, and something that he will remember, that he made an impact on my nursing career. Because there was also a moment in the day that he was unsure of like I said, surgery, and he was able to talk to the physician. We also watched a video on the type of surgery specifically, so we were both learning and continuing our education, even if we were unsure of something. So clinical objective number 4 was critically evaluate and disseminate current research related to the principles of leadership and effects of the healthcare system. I personally felt like I met this objective throughout my interprofessional logistics and the continuing education videos that I watched that were explaining how we need to be prepared, any ethical dilemmas that can occur during emergency situations, how logistics plays a factor and leadership behaviors, who gets left behind, who gets medevaced, and who is a priority in a medical emergency, how we make sure that there's a state policy for for the equipment we need in case an emergency occurs, who gets how we are affiliated with medical responders and EMT, and how it was just how in the ever-changing world and being able to use research and different apps now and media to make sure that we are ready for anything that comes our way, especially in the medical profession, and changing and implementing different resources like team steps and quality management to improve the healthcare system. For clinical objective number 5, it is function as a competent patient advocate, nurse advocate, and change agent. I personally felt like I met this within my community blood pressures and Capitol Hill Day. With my community blood pressures, I was able to be a nurse advocate on different lifestyles and how hypertension, hypotension, different dietary changes can always play a factor in blood pressure. And these are already health savvy visitors, since they were at the aquatic center, so they didn't need much implementing. But at the same time, some people were also bringing me their card to make sure that we were telling them their blood pressure, so then they can tell their physician, and keeping track of their lifestyle and their changes. I also felt like I did this at Capitol Hill Day when I was able to ask about PA being a contract state, why we weren't a contract state, and how why, and being able to listen to different policies and procedures and laws being passed to help the nursing field. Now that I think of it, I also feel like I found this at service leadership within the Trinity Soup Kitchen too, by being able to listen to people's stories and being a change by making sure that they have food and have social services. There was a social worker there in case someone needed something that we couldn't fulfill. There was this one guy that was there, and he was having a cold, and his throat hurt, and he said he was cold at night, so we were able to get him a blanket and lozenges and little things to get them throughout the day with a stomach full at the same time. So I thought I was a change agent in that, and being able to advocate for someone within the community. For clinical objective number 6, it was formulate plans for continued personal leadership growth and development as an independent practitioner of nursing and contributing member of society. I plan on doing this objective continuously throughout my career. Not only do I feel like I met this throughout Not only did I feel like I met this throughout my service leadership, but I met this throughout my peer leadership by being able to help the undergrad students in with using the knowledge that I've already learned. And like I said, so not only I was able to learn more than I thought I did. If I was unsure of something like peritonitis, I was able to do a little more research on to ensure that I was giving them the right information. And I learned just as much as they did, if not less. But at the same time, it was a learning experience for all of us. I also feel like want to continue to do service leadership once the pandemic settles a little bit. I plan on going back to the Trinity Soup Kitchen to ensure I can play a part in the community and not only improving my therapeutic communication and being a change agent, but like helping my confidence and my communication skills and being a part of the community itself and representing not only the college but who I want to be within the nursing field. So I also personally, and then I also want to continue to do research, and like I'm not sure if I plan on going for my MSN at this point, but I just want to continuing to improve myself, improve like the skill sets and the knowledge learned, and continuing to be the best that I can be. So clinical objective number 7 is recognize the role of the nurse in policy making related to healthcare services at local, state, national, and global levels. I personally felt like I met this throughout my Capitol Hill Day. Not only was I able to talk about being a non-contract state, but I was able to learn about different policies being passed that are helping the ever-changing healthcare system and who is on our side, especially in our legislative, who within our legislate is willing to help us and who is on our side, and different people that are supporting the different policies to help the healthcare system. So our clinical objective number 8 was predict and describe potential ethical dilemmas within clinical, organizational, and professional nursing practice. I felt like I met this throughout the nursing supervisor case study, where a nurse made a medical error and who played a part in it, how can that be improved, what happened during the situation in the post-op care, and I was able to kind of break down on what went wrong, how can we improve something like that, like the team steps in being involved, that the quality management to continually improve the safety and quality of care given to a patient, and to check like what could occur, like if there was a staffing issue, since it was a written order during the case study, like was this back in the time like when like EHRs weren't involved, like if this was an actual electronic order, like would this have fixed it, like what can we do to fix this problem. Also during the other videos I watched, like for medical emergencies and being prepared during like disasters, like natural disasters such as like tornadoes, floodings. During the one video there was it was talking about what type of leadership you need to be and who is in charge of making the decision on who gets to stay, who's medvaced, and what that can how much impact that puts on the community, how that portrays the hospital and the staff that it concurs, and the organization that they try to portray. Also, the ethical dilemmas for the nursing practice, like with the FEMA videos, with the crowdsourcing, make sure it's a reliable source. Now, if people read the wrong news, they can personally believe that we're just out to get them, like with the pandemic, and how they think it's all fake news because we're trying to tell everyone to quarantine, yet they think the nurses are the ones that are in the wrong. So there's always going to be ethical dilemmas, but it's how you portray yourself in the hospital and take pride in the career and the decisions you make to ensure that you're following the administration for medication properly, that you're following, that you are being a transformational leader, that you are practicing non-malevolence, and you are being the best you can be, following the code of ethics, and continuing to try your very best. So that is my clinical reflection video. Thank you so much for taking your time to listen to me and explain the experiences that I've had and how much the impact that it made for my nursing career. I really appreciate your time. Thank you.